I have these horrible dark circles under my eyes and deep lines that never go away. Only 27 years old. I limit my exposure to the sun. I tested negative for allergies. I try to live a healthy lifestyle. My father has the same thing, so this may be genetic. These lines and circles have gotten noticeably worse. How can I get rid of these?
Thank you for your question. You're 27 years old, you submitted a single photo, and you state in your question that the under eye bags and dark circles have been getting considerably worse, that you have done everything to avoid excess sun exposure, and that your allergy testing has come back negative, but you state that this is a genetic trait that you inherited from your father, and you're looking for options and for possible solutions. Well, I can certainly give you some guidance as to how I approach situations like yours in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and treating the eye area and the cheek area for people like yourself, especially younger people, can certainly be very frustrating. It's one of the most common issues we deal with in our practice. So I'm going to give you an approach that's based on how the systematic thinking that goes behind dealing with the anatomy and then what to do about the anatomy. So to begin with, we'll start with what is the most straightforward and to me the most dominant issue for you. And I think that is the puffiness. The puffiness certainly further accentuates the significance of the dark circles. So it creates this perception that you're very, very tired. That puffiness is an issue that's anatomic due to something called lower eyelid fat prolapse. Lower eyelid fat prolapse means the fat that's normally around the eyes pushes forward, creates this bulge, and maintains this continuous look of looking tired. It's fascinating how this one thing can actually change the whole face. And people will often say that everyone around them asks them, are they tired? Have they got enough sleep? And are they worried? And things like that. So to deal with the puffiness under your eyes, currently there are essentially two solutions that are generally offered depending on the doctor you go to. One is the solution of using injectable filler to try to camouflage the puffy under eye bags, and the other is to do a surgical procedure to reduce the fat pockets. Now, in my opinion, with the photo you submitted, I think that trying to camouflage the under eye bags would not be as successful. And it's because that when you look at the trough, the tear trough area that's right below the under eye bags, it would take a lot of filler to fill that area to camouflage what's hanging over. Patients come to us from all over the world who have had injectable fillers around the eyes, and very often we have to dissolve them in order to actually see the underlying anatomy. You see, when someone gets too much filler under their eyes to hide an under eye bag, it ends up making the baggy looking area worse. And it actually takes you two steps backward. I think that there's a certain degree of opportunity for you with fillers, possibly, but I would say that the procedure that I would suggest considering is something called a transconjunctival blepharoplasty. Transconjunctival blepharoplasty is a procedure I do typically for a younger person with under eye bags. And what I do is I address the fat pockets from behind the eyelid. This way, there's no external incision, no external scars, and it really does address the issue directly. We're able to address the fat pocket by reducing it, by repositioning it, by sculpting it appropriately, so that you get a nice contour as if you never had the bags. Now, moving onward from there, and by the way, the approach to doing this is through local anesthetic with light sedation, which means you don't have to have general anesthesia or go to a hospital. In our offices in Manhattan and Long Island, we have facilities for surgery that are certified by the Joint Commission, the same people that certify hospitals. And so to meet the appropriate protocols and safety standards while having the convenience of an in-office facility has been a tremendous advantage for us, and we do this surgery pretty much every day in our practice. Now, that being said, let's talk a little bit about the dark circles. There's one element of the dark circles that has to do with genetic ethnic pigmentation. That is difficult to really make a significant change in. However, I have found that when we deal with younger people who have situations like yours, combinations of approaches using something like platelet-rich plasma or PRP, where it's injected under the skin to stimulate collagen and improve skin quality, it has a kind of a lightening effect on the under-eye dark circles, as well as improving its skin quality that tends to be beneficial. On top of that, we also do consider using some topical creams, as well as even some light microneedling or laser procedures, but generally I try to avoid that when we're dealing with darker skinned individuals. So we take it one step at a time, and I think PRP injections will probably be most beneficial. Now, the reason I mentioned earlier that there may be a role for addressing this area with some filler is that if you look at the bottom of where the bags are, there's this little dip called what we refer to as the V deformity. There's a relative anatomic volume deficiency there. Sometimes we get some benefit by adding volume with a filler such as Restylane or Juvederm. Now, fillers for someone who's young is often an obstacle that has to be really considered thoroughly before moving on to having it done with consistency, because fillers do require maintenance. And that's something that I would typically discuss with my patients after taking their photos and showing them on our screen what they look like from different angles, so they understand what's bone deficiency, what's puffiness, what's pigmentation. Really, a proper consultation is critically important to understand what the optimal plan would be for you. So I recommend you meet with qualified, experienced cosmetic surgeons and learn about these options, learn more about the option of transconjunctival blepharoplasty, platelet-rich plasma for skin quality, and I think that you will find that you can really make a nice improvement and still look like yourself, look natural. So I hope that was helpful. I wish you the best of luck, and thank you for your question.